So Medicare Locals are new organizations. Ours was the very first Medicare Local in Australia, created on the 1st of July 2011. And we work with a range of healthcare providers and with the community in our efforts to see a community where good health is available for everyone. So we're running 8 different forums across our geography, the first one here tonight in Kilcoy. What these forums are about is finding out what people actually think about their healthcare needs and what we can do to improve things.
Look, I think evenings like this are very important so that people know what's out there and available to them. Without people getting out and doing these kind of evenings, there's a lot of people that don't know what help is out there. So it's absolutely great to be able to have something like this.
And I'm sure there'll be some people here this evening that will ask questions, and the more we know about what is available, the more we're equipped to assist people.
You know, the community may be made aware of the problems. A lot of people know that we have the problems. They know that they should be rectified, but some of the times they won't come forward with ideas and things like that. And nights like this are the ones that really get people to come out and put their own thoughts and their own ideas across to meetings like this.
Aboriginal people get a lot of tokenism. People will talk to 1 or 2 people and they've consulted with the Aboriginal community. Taking the pulse here tonight has actually demonstrated that the Aboriginal people are being heard. These are all very positive things. They wouldn't have done it before. They haven't had the opportunity before. Sitting here around these tables, they're coming up with those ideas. They're taking control of their own things that they need in their community. Nobody else is telling them. And I think that, for Aboriginal people, is very positive.
The RSL was tied up with the Connecting Kilcoy community when it first started, and that was very important to us. And we've been very supportive of any event in the Kilcoy community. Men's health, Seniors Week, diabetes, and etc., things like that.
It can only help us as a community, but I think we're progressing quite well on the other hand though, especially with our practice. We're very proactive, and I just think that Medicare Local coming on board, or us coming on board with them, has benefited us greatly. But not just so much us, it's the patients. They've just received so many benefits through Medicare Local.
I don't know how many people are in the hall tonight. There'd be at least 40, 50 people. Now, to get those people, and if one of those people go out and talk to one member of their family, they talk to another member, the message is getting out on the ground. These type of forums are actually putting it at the community level. It's not at the management level. It's not at the bigwigs sitting around a table making decisions. These people are having input at the community level. They're the coalface, they're the people, the recipients of the services. So the information that they get would be valuable.
I think the more people that get involved with things like this, the better. I believe that this is the first one of these to be had. So, you know, I think it'd be good if we can move this right around our region and get people involved, because the first one's always the hardest to get off the ground. And I just like to thank everybody for taking the time to put it together.